I started riding a bike, I think, around probably 1954, 55. I was probably around 5 years old or 6, something like that. And we used to ride up and down the street back then. There was not too many cars. Nobody used to bother you. I sort of found out I had diabetes probably about, I guess, just guessing that because I don't remember exactly, probably about 7 years ago, 8 years ago. And started taking some medicine for it. The doctor was going to give me another pill and prescribed another pill, and I said, I don't want to take any more pills. So I decided to start riding a bicycle.
When we have a patient like Pete coming to the office to monitor his medical conditions, and in this case, particularly of interest to me is his diabetes and his blood pressure. And unfortunately for Pete, his blood sugar hasn't been really well controlled to what I would like him to, and he wants to have that better as well. And he was already taking multiple medications and doing the best that he could, and yet we could not get him to where he needed to be. And so I told Pete that I can do is add another medication, or I can introduce him to a what we call chronic care management program that we have with Inspira Health Plus. With this equipment that he's using, it has the capability to transmit the data. So whenever he sticks his finger at home and check the sugar, it transmits it to our data center, and we're able to see that or capture that piece of information real time. But the same thing with the blood pressure. When it's completed, that piece of information or the electronic data, it's automatically sent back to us. We have a group of nurses who are trained in this area where they can actually provide what we call education to the patient, and they can monitor, they guide him, they can actually call him, contact him and alert him, for example, when the blood sugar may be going too low or going too high. When we have patients who are motivated like Pete, it is very, very useful, and they can use this type of information to better manage their health.
The more exercise that I did, the lower the sugar went. And not only that, my cholesterol went down, the blood pressure also went down, and my weight went down. 10 years ago, or 11 years ago, or 12 years ago, I probably wouldn't be riding a bike like this. I ride between 8 to 10 miles. I probably ride at least 26 days out of the month. Health Plus has really helped me out a lot, because if I didn't have the Health Plus, I'd probably stick that third pill.
The best part of medicine is when a patient comes into the office or calls me to tell me that, Doc, I am doing much better. And then we have proof that he's better with his labs and his general well-being. I mean, what else can a physician ask for? It's knowing that he has the support whenever he needs it.
I mean, it sort of feels good that somebody else is looking at you that's concerned, not just say, oh, here's a number, and they check when they're concerned about you. I'm going to continue riding my bike as long as my legs last. They don't stop or anything like that. Yeah, I'll keep on riding.